When it comes to containing costs in healthcare, everyone has their 2 cents to give. But what do those of us in the business of health insurance have to say? This is Health Sense, and I'm your host, attorney Adam Russo, CEO and co-founder of the Phia Group, a firm with over 25 years experience navigating this ever-changing industry. Join me and my guests as we make sense of effective ways to reduce the skyrocketing cost of healthcare while improving quality outcomes for patients. The only thing it will cost you is 30 minutes of your time. So let's get right to the bottom line and reimagine what healthcare could be. Hello, everybody, and welcome to Health Sense with me, your host with the most, Adam Russo, the show that gets right to the bottom line on ways to reduce healthcare costs while improving quality outcomes for patients. As always, we're sponsored by the best company in the world, the Phia Group, the leading cost containment firm in the country focused on ensuring everyone gets access to high quality and low cost care. And as always, please tune in at 10 a.m., 6 p.m., and 2 a.m. Eastern Time for you night owls on Healthcare Now Radio. We all know the main problem in America when it comes to healthcare can be tied right to Einstein and that definition of insanity, doing the same thing over and over again, expecting a different result. Well, I can tell you, in this part 4 with Scott Bennett going over the NSA, the IDR, crazy medical bills, surprise medical bills, well, they did try something new. They definitely tried something different, and it definitely produced a different result, but not a good one, right? So as I said previously, today's guest is Scott Bennett, the chief PRO. And if you've been listening, you know what the PRO stands for. Hey, what's up, Scott? How you been, bud?
I've been doing good. Been looking at bills and learning about this like everybody else, to be honest.
You know, it'd probably be really good for my marriage if my other half looked at bills. That might help. That's a joke. I'm only kidding, Kelly.
Right.
All right. Well, welcome back to this series on medical bills. I know in earlier episodes we went deep on the heart attack. We talked about that, the balance billing dispute, etc. We talked about the NSA, the IGR. We went into it. This one, oh, I almost forgot. What's our word of the day? The word of the day is bat. Now, why would I say bat? The first case involves a bat that turned a vacation into a nearly $21,000 bill for post-exposure rabies treatment. Scott, now the crazy part, I don't know if you want to describe it, where the bat actually was.
I know. And well, you got to give it context. So this is a
Right.
photographer. This is a photographer taking pictures in the dark, and they're taking pictures of bats. And as you've probably seen, everybody has, bats fly in huge, frantic. I don't know what the term is for a big group of bats, but big groups. And one of the bats got between her face and the camera, and as she put it, ended up in her mouth a little bit as well. And that has cause for concern. So she talked to her father, who's a doctor, and he said, rabies, once it takes hold, is fatal. You've got to get in and get rabies prophylaxis, I think is the term, to make sure that you're protected from that virus. So that's the injury that occurred was
So
exposure to bats.
just so people understand, and she said, and I quote, the bat ended up in her mouth, end quote, for a few seconds. Oh my God, that is insane. All
No
right, so get
kidding.
into the bill. What happened? So what
Yeah,
happened?
the bill. So she see her that was recommended. She went to a nearby hospital, Flagstaff Medical Center, and she had immunoglobulin and a vaccine. And so that the hospital then, once it administered that was an emergency service. And then she had to get a couple more services down the road. Now, one of the things that's interesting about this is it sounds technically uninsured from the article, and she got short-term insurance after the first event to see if she could use the short-term insurance for the later services. And so then the hospital and the later services started sending statements and bills, and they were for incredibly high amounts. So the first bill, the hospital bill, was close to $17,000, and that was for the vaccine and the immunoglobulins. And then after that, the later bills were in the thousands as well. So we'll look mainly at the hospital bill, that main one, but that's sort of the bills in the context we're looking at here.
So, like, can you explain to the listeners, when someone gets a bill typically from a hospital, how that's different from an itemized bill when it comes to this context, right? So how does it all work? I mean, you explain the money, very big sums, but how is it explained to the actual patient who
I,
may be responsible for the bill?
I think that's a great thing because there's so many documents and so many different ways to write this. And it goes to so many different parties, all these statements of what was done and that sort of thing, that it is very confusing. You get a letter and the letter has an amount on it, sometimes just a lump sum and it says to pay it. Well, that could be technically a bill. It's more like a statement. And the that's not really when I'm talking about hospital bills and hospital billing, we're talking about some standardized forms that typically are only exchanged and seen between the carrier or the insurer and the provider. So when you get your statement, the first thing to do is request additional documentation. See if you can access or get that actual bill. And then beyond that bill, so that you've got the statement, you've got the bill, and the bill has some codes on it, and everything. And then you can even have in some hospital systems an itemized, really laid out statement of every drug, everything that was done. So really, you're looking for that trifecta. You're looking for I need the statement. I need the UB, uniform bill is the typical word for it for a facility. And then I'd also like the itemized bill. So that's something you want to keep in your pocket to ask for as soon as you get these kinds of things.
Great recommendation from our expert here, no question about it. Now, in this particular situation with the bat in the mouth, right?
Mhm.
How does this bill get so expensive? I'm assuming it was the drugs, right? It was with the drugs. And can you go
Yes.
into that in a little detail?
Absolutely. So on the statements that were posted, and this is from Kaiser Health News. This is the reason we can talk about this is someone decided they wanted to submit, what the documents they had and get a write-up on it. And so they've done that. It's in public record. So the statements that we reviewed in order to see it, they did have some CPT codes on them. Not on the specific hospital bill, but there were CPT codes that would represent immunoglobulin and the vaccine. So the way that you find out, Adam, whether or not they're reasonable and what's going on is to look at those CPT codes, the 90375 for immunoglobulin, 90675 for another or the vaccine, and then for the injection, 96372. So you've got these 5-digit procedure codes, and then you can start to benchmark and look at the reasonableness of the codes.
So I'm assuming because this bill is on the radio show as a topic, that the bill was unreasonable in your opinion.
Well, I would argue it was definitely billed very high. Now, if this amount of money is intended to be collected, that might be unreasonable. Bills starting out high. I mean, MSRP on a car starts out really high, but the idea is that nobody should be forced to pay that. So same here. The desire for the full payment on the bill, that I would say appears unreasonable. And here's why. If you look at the benchmarks for this, if you look at, for instance, we'll start with public record benchmarks like Medicaid. Now, Medicaid, again, that's a government program. They're going to be down at the bottom. That represents, like we said, another one's costs. So the costs, are around $300 to $500 for these. And this bill, the hospital bill alone, was $17,000. So that
Unbelievable.
sounds like a lot of money for that. And even the vaccine on 3 to 500. And there's data from consumer guides that say that in the entire 4 series treatment for rabies with multiple vaccines and immunoglobulins can be anywhere from $2,500 to $7,000. That's an amount that's considered reasonable. And here we are for the first one at $17,000.
That's insane. Now, I mean, again, to me, and the fact is that every facility, whoever it might be, is very well aware that 99.99% of the patients that are looking at these bills, whether they're itemized or not, regardless of how much detail they have, and they have no idea how to actually compare what they're being charged to what is the right amount. Like if
Right.
I just went to the supermarket today, okay? I bought milk. Now, I have a rough estimate as to what the range of that milk should cost. But if it's $45, unless it's going to, make me younger again, I'm not buying
Mhm.
that milk. So what protections does someone like her have? And the follow-up question to that is, I'm assuming we have insurance here, right?
Right. Yeah. So there's that short-term insurance. We'll talk about that, and we'll talk about what the member of the patient can do. First, this is an incredibly complex medical billing, CPT codes. All this is incredibly complex, and it used to be you'd need to look for an advocate, somebody who understood this stuff to talk you through it. But Now, if you have general questions, you can ask and get credible responses from artificial intelligence. So that's a new thing that's in here now. If you have a CPT code 90, if you ask for the bill and you get the codes and you see 90375, 90675, and 96372, at the very least, without putting in any of your personal health information like that, you can look those up on the internet. You can ask for a description of those codes, and you can verify that the codes match the services that you receive. Now, that's going to be very important down the road. Secondly, for insurance, short-term insurance has a waiting period when you
I
sign up
couldn't,
for it.
right. When I read this, I couldn't believe that she was actually able to sign up for the insurance
Yeah,
and not have been told that. I mean, there's no possible way in my mind that this person could have actually been told, whether it's on a screen, somehow.
yeah,
Please note, your insurance is not effective for 30 more days.
yep,
I read the story. She purchased the short-term insurance the day after she
yep,
went to the hospital,
yeah,
thinking, oh, all, future care is going to be covered. And clearly it's excluded. It's,
yep. And
amazing to me that would happen in this particular case.
yeah, it is, and it's tough because it shows that the understanding of insurance is really important. So in this, it was in the waiting period, so these were all denied. The claims were all denied, and so she was billed for the amount. And being being short-term insurance, that kind of classifies you in the uninsured bucket, where
Right.
you're just considered to not have insurance, right? Oh, one other benchmark that I want to bring up is transparency files. Hospital systems now post their prices online. They're required to. It's this sort of ambiguous spreadsheet. But once again, you can use artificial intelligence to help you discern what's going on it. So if you had gotten the Flagstaff Medical Center spreadsheet and you had the codes, you could take their transparency file and the codes and say, what would the commercial payment for this be? And what would the cash pay be for this?
And you'd
And
be
you
able
could
to get
get,
that response.
yeah, it'd be able to say, okay, I've got the spreadsheet that the hospital made of their stuff. It's difficult to decipher, but I know how to do it. And I've got the CPT codes. I can look them up. I can even fuzzy match the services.
Don't you find it interesting though, right? I mean, obviously, everything you're saying, every single person listening does this in every other aspect of their life.
Yeah.
So, like,
Hmm.
how many times have I been to even, I don't know, like any type of store, a big store, like a Lowe's, where I see people
Yep.
literally take a picture of the item, right? They want to feel it, they want to touch it, but then they
Yeah.
want to go online and buy it because it's cheaper. So
Yep.
people are very well aware of how to price shop.
Yeah.
Old grandmas to 22-year-olds, we all know how to price shop. But when it comes to medical bills, no one thinks to do the exact same thing as what you're saying right now in regards to
Right.
what's reasonable. They get the bill, they get a collections notice. So in her situation, no insurance, so she's part of the uninsured, right?
Yep.
Are they out of luck in this situation? Like, what happens now?
Uninsured in now and if you're not insured, you've got short-term insurance. The No Surprises Act is supposed to protect from these kinds of emergency bills, but it does so in a different way if you don't have insurance. The only protection that it provides is you have a right to get a good faith estimate of what you're going to pay. And then if that good faith estimate ends up being over $400 over whatever you were going to pay, then you've got an arbitration process you can go into. In this scenario, with an emergency service, there really isn't a chance to get a good faith estimate. She could have gotten one, but that good faith estimate very well may have been a very high estimate to
Right.
begin with. Now, in this one, looking at all the facts and doing the research, it looks like the cash pay for Flagstaff Medical Center is around 50% of what they bill. So it could have been that she's going to negotiate and end up paying less. They're going to write off some of it once the
Right.
insurance denials just don't come through. And so that's positive. But the NSA protects people a lot more when they have comprehensive insurance because you don't pay more than your median network
Now,
rate, your copay.
if you're just joining us, you've missed out so far. And my guest for part 4 on our series tied to everything NSA and the No Surprise Act, Scott Bennett, the Chief Provider Relations Officer at the Phia Group. Speaking about that air ambulance, right? The second bill that I want to talk about.
Hmm.
$13,000 for this ride.
Yep.
So tell me about this ride. I want a caviar.
Yeah.
I'm
Yeah.
assuming
So
caviar, a full band playing in
no
the back,
kidding.
massage chair, right? I mean, you're getting it's like a spa day, right? I mean,
No
that's
kidding. Oh, I agree. And when you look at the actual scenario where it was a runner out in San Francisco that got hit by a car, and not not it was they were hit by the car, and so the ambulance came, or not the ambulance, they took them to the hospital, and they were treated for a broken toe and perhaps a minor concussion. And then they said, "We need you to be transported 6 miles to another hospital for trauma just to check." The runner was transported there and then discharged. Once they looked at him, they discharged him. So this isn't a situation where somebody was it wasn't life threatening. They didn't end up in the ICU. It wasn't that sort of thing. It was a serious injury that received treatment and then a 6 mile transport between two hospitals with a stabilized patient, $13,000.
Wow. Now hold on a second here, Scott. I want to gear into that second bill a little differently.
Mhm.
Really interesting. Bat in the mouth, insane bills. Obviously, protections are supposed to be there for these people, but it looks like there's loopholes, arbitration process. It's just not a very clear process or one that makes a lot of sense, to be honest. But let's switch gear and talk about the second bill. Since you were bringing up ambulances and we were bringing up transportation, you know, what do these ambulance rides cost? Now, I have a second bill here that looks like is a $13,000 ambulance ride. Tell us a story.
Yes.
So there's plenty of people that take rides in ambulances. Plenty of people go to the hospital running. What's so special about this bill?
Well, if you look at the bill, this tracks with what we said before. The first thing you want to do is get a statement that has those codes. So the CPT codes on this bill are very important. And the codes are, although not, I'm going to say they're not going to sound important, but I'll tell you why they are. A0434, A0425, and 93005. So those codes, the first one, A0434, that's for a special circumstances, complex kind of transport. That's when somebody is in the ICU and they've got to get them from the ICU to another ICU. Or they're on a ventilator or something like that.
Like
That
literally
code,
life and death situation. They have to get there fast and they got to
yep,
stabilize this person. And it's a tense, high stress, crazy ride.
yep. And that you can imagine if somebody was on a ventilator or somebody was in the ICU on the brink of death and they had to get them to another hospital 6 miles away, perhaps having a nurse in there and the kind of transport that would require could be one where I don't know if justifiably the billed amount could be 13,000, but the paid amount still would be high on that. So that complexity and that code doesn't match with the services. So that's where it's really important to understand the code. Taking another steps, A0425 is the mileage. So the mileage really has to do with the vehicle. And this mileage was $122 billed a mile
A
instead of
hundred,
the
wait,
typical $50 or $40 billed a mile, right?
$122 a mile.
Yeah.
You know what? I used to drive a taxi back in the day. That would be an awesome rate. I'll do anything.
Definitely.
I'll have an
That,
oxygen tank in the back seat if I can
no
get paid
kidding.
$122 an hour. So how do these ambulances? And again, everyone needs to make money. Everyone needs to make a profit.
Mhm.
How can they do this? And how is
The,
this allowed?
well, the ground ambulance is really interesting because ground ambulance sometimes is a service provided by the county or the city. It's a public service almost, and those rates are set by the city or the county or statute in some areas. But also, some cities or counties will contract with an independent provider, and that independent provider can set their rates. And
Wow.
that's where we run into situations like this where they end up setting very high rates. And then it's about them whether or not they can contract for this and their aggression. And ambulance is not something people shop for, really. So it's a problem
Obviously,
there too. Yeah, no
right? I
kidding.
mean, no one's like,
Mhm.
okay, hold on, let me choose the ambulance provider that I'm
Right.
going to pick, and they're going on
Yep.
some website. I mean, it's an emergency, right? So that's
Yeah.
where they get you as well. Is that it's really not your choice. So
Yep.
no, so in this situation with this Cadillac ambulance bill, what
Mhm.
happened with the bill? I assume did the patient have insurance? Give us the lowdown there.
So initially, the insurance denied it. So it was they hadn't the patient had insurance. The insurance denied it initially, and they appealed that, and then the insurance paid it. And the insurance paid about 9 grand out of this 13 grand, and there was still two to 3 grand left. And the father of the runner paid the rest because they were concerned about collections and credit reports and things like that. And then what happened in this one? This is an interesting circumstance. There was a review from what the article says and the father's money was credited back by the ambulance provider. They said, "Hey, we took a look at this, and this code is not the code that should have been billed. It was too complex." Now, I didn't see it in the article, but my sneaking suspicion, understanding how all this kind of works, is I bet the insurance company went back at some point and said, wait a minute, we're looking at the narrative, we're looking at the itemized, the records,
They had an
and we're
audit
looking
done.
at this bill, and somebody needs to give some money back. So the insurance company pursued it under what I call, this fraud, waste, and abuse. And then it bled into, of course, we have to give the money
Well,
back to the patient. That's
it
my
brings up a
guess.
whole it
Yeah.
brings up a whole other topic that we don't have time for today in regards to why the insurance company would have paid that bill in full or that much in the first
Mhm.
place. Why they're doing post payment audits instead of prepayment audit in that situation. But whatever, we can talk about this some other time. But
Right.
this ride to the hospital, this ride to the hospital obviously was a surprise, right? I'm assuming the person's running around. It could be in network, but it could be out of network. But I'm assuming the No Surprise Act applied in this particular situation, and if not, why not?
Yep, and it doesn't apply. The No Surprises Act carved out ground ambulance, and I think the reason the No Surprises Act carved out ground ambulance, because I've had to negotiate and work on these, is a lot of times, like I mentioned before, the city sets it. It's a county service, and their rate is their rate. It's
Right?
not
It's not a
it's not
private
for
company.
profit yet. Exactly like that. But you have pockets where there are private companies, and that's one of those gaps or loopholes where ground ambulance does not fall into the NSA, and it's a real problem. And there's
I
advocates
would,
trying to go ahead.
you know, for the same argument you just made, how it's a county ambulance. Well, there's county hospitals. There's city
Yeah.
hospitals. There's plenty of those too, nonprofit. So to me, what would be great is another 5-part series down the road where we can literally investigate how much money was spent by lobbyists to keep the ground ambulances outside of the NSA. Because think about what that would have done for the for-profit ambulances. How much less revenue they'd be bringing in per ride than they currently have the ability to do. Because the whole point of the No Surprises Act was to protect people from
Hmm.
large bills that they didn't expect. A surprise, right? You're on
Yep.
vacation, something happens that you're not expecting to happen, and you're not even near your home in many cases. How
Yep.
you would not include ambulance in that doesn't make any real sense to me.
Yep. And I think that'd be great. The topic could be just the instances where the No Surprises Act didn't prevent surprises. And I think that would be interesting.
All right, we're running out of time, Scott.
Mhm.
As always, folks, this is your host, Adam Russo, on My Health Sense on Healthcare Now Radio, and my guest for part 4 on our series tied to everything NSA and the No Surprise Act, Scott Bennett. All right, Scott, how do these two stories blend together? What's the common thread that they have, and what can our listeners take from these two examples?
The two examples really highlight the importance of getting the right information. When you get a medical bill, you want to make sure you get, and the key terms are, if it's a facility bill like a hospital or something, you want the UB. You want to ask for that in the itemized statement. If it's a professional bill, you want a good way to call it is the HICFA, or that bill that is typically sent to insurance, because that bill has a lot more information on it. And then the second part is, once you get that information, without entering, don't randomly enter your personal health information into websites or whatever, but the codes and some of the components you can certainly ask about and research those. And there are good resources to get enough information to, as you saw with these, change the story a little bit if you can negotiate from that knowledgeable position.
Well, as always, Scott, you are the man. Bringing these two stories together, how you were able to get a runner running around in San Francisco tied into a bat in the photographer's mouth. Oh, I can't even imagine. I'm happy she had swallowed that thing. Folks, that's
Okay.
all the time we have for today. Again, this is your host, Adam Russo. We're sponsored by the Phia Group, the leading cost containment firm in the country focused on ensuring everyone gets access to high quality and low cost care. Please tune in at 10 a.m., 6 p.m., and 2 a.m. Eastern Time for you night owls on Healthcare Now Radio. If you're looking for a company that can help you with your NSA, your IGR cases, just somebody, an organization with lots of expertise in balance billing, pricing claims, I think it's pretty clear you want to talk to Scott and his team at the Phia Group. Scott, thank you so much. And folks, as always, like I say every time, every episode, let's go Cleveland Cavaliers. Have a good day.